Hey there, everybody. I'm sure you've seen this week that we're going to be talking about heart failure. And so, what I wanted to talk with you all today about was heart failure and exercise. So, if you've ever worked with a heart failure patient, you are sure to notice that heart failure is not, or exercise is not very well tolerated in the heart failure population. It's often one of the first things that you might notice when working with this population. You know, they have to take very frequent rest breaks. They're not able to stand for a long period of time. They're not able to walk far distances, things like that. You know, so if they've not already had a heart failure diagnosis, it might be worth talking to the physician about too, you know, just to see if their cardiac functioning would need to be evaluated further. But what research is saying is that the exercise intolerance is most likely due to the quality of the oxygen utilization that we have. So it's either a matter of our body's not getting enough oxygen delivered to our muscles and our tissues because of the decreased cardiac output, or it's the muscles themselves that aren't able to utilize the oxygen that is being delivered. So regardless, you know, we want to make sure that we're monitoring their ability to tolerate these exercises. But we don't want to simply avoid exercise itself just because it's difficult for that patient to do. Research has shown that high intensity exercise will actually help our bodies utilize oxygen better, which, as we just talked about, could be the exact reason that they're having this inability to tolerate the exercise to begin with. So you got to think about, you know, what does high intensity mean? Because high intensity to me could mean something completely different from a person with heart failure, and then it's going to mean something completely different to, say, an elite athlete. You know, so it could be a very subjective thing that we're talking about. Or you could utilize something more objective in your clinical practice to make sure that you're hitting the exact intensity that that person needs in order to meet the goals, in order to make everything functional, more easy to them and less intolerable. So what I'm talking about is calculating their heart rate max, and then from that calculating their target heart rate that they should be targeting. So it's something that we've all learned about, but it's something that very few of us actually use. You know, so the calculation, the easy calculation for the heart rate max is 220 minus your age. You know, so say you have a 60-year-old person with heart failure. So their heart rate max would be 160 beats per minute. So you want to take that heart rate max and then you want to calculate your target. You're going to say, all right, we're going to do some high intensity work. This is the range that I want your heart rate to stay in. And when you're talking about different intensities, what research has also shown is that, you know, moderate intensity is considered to be between 50 to 70% of your heart rate max. And then high intensity or vigorous intensity is considered to be 70 to 85% of your heart rate max. So if you take that same patient, that 60-year-old patient, and you calculated their heart rate max to be 160 beats per minute, then you would figure out which intensity you would want them to be in and do another math equation and figure out, you know, are you going to go a little bit more on the lower end just to get them started with it and then build up, or are you going to go right to the high intensity, you know, calculate that 70 to 85%. So for that patient, you know, if you go all the way from 50 to 85%, you could be targeting anywhere from 80 to 136 beats per minute. And I did that all beforehand. I didn't just do that all in my head. But maybe I shouldn't have let you in on that. But anyway, so you want to just make sure that you're giving them the range that you want them to stay in. You know, so if they're able, you feel like, you know, you want to throw everything at them and they're able to do that 70 to 85%, figure out the range and provide it to them. And then, you know, a lot of patients too have Fitbits, you know, different things like that they can monitor their heart rates these days. So the equipment, you know, wouldn't be so, yes, math genius alert, there I am. But the equipment wouldn't be such a barrier, you know, so like those small finger pulse oxes are very inexpensive as well if you do want to go that route. You know, so providing them the equipment, or if they already have the equipment, and then providing them the exact target heart rate that you're wanting them to achieve is the way that you're going to get the most effective intensity of exercise for this population. And then you'll start allowing their bodies to or facilitating their bodies to utilize the oxygen more properly, and then they'll be able to tolerate the exercise better. Their cardiac function will get better, quality of life will be better, just the whole picture will be better. So it's something very easy. Like I said, we've all been taught about this concept, heart rate max, target heart rate, but it's something that we very rarely pull out of our toolbox. So I encourage you all to start using it with your heart failure population, and let us know all the results that you get. All right, so stay tuned this week and we'll talk more about heart failure with you guys.